नमः। ओम शांति, ओम शांति, ओम शांति। अब बोलिए, अब शुरू हुआ है। जब मेरा खत्म हुआ तब फिर दोबारा नेट आई।
आप ओरिजिनल हैं, आप ओरिजिनल हैं, डुप्लीकेट है, ये तो टेक्नोलॉजी है। वहां भी आप हैं, यहाँ भी आप हैं, यत्र तत्र सर्वत्र हैं।
जय भोलेनाथ, जय भोलेनाथ।
पवन जी है ना, पवन जी तो हर जगह पर है
जी।
So I welcome all expert dignitaries, respected Professor K.K. Sijoria ji, Professor V.K. Agnihotri sir, Professor V.P. Sharma ji, K.C. Priyadarshini ji, Ramakant Yadav ji, Professor E. Sharma ji, Dr. C.P. Sharma ji. Welcome, welcome, Dr. J.S. Chaubey ji sir. Without wasting much time, I would like to hand over the stage to Professor Vishnu Prasad Sharma ji, ex-principal, Government Ayurvedic College, Guwahati, and President Vishwa Ayurved Parishad Assam. Welcome, sir.
Namaskar, good evening, respected distinguished guests, eminent speaker. वॉइस जा रहा है ना?
आ रही है।
आ रहे हैं, हाँ। Respected distinguished guests, eminent speaker, ladies and gentlemen, I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on important subject, prostate enlargement, Ayurvedic treatment. So in this evening webinar, we have eminent speaker. I want to invite Dr. K.K. Sijoria, former principal, Government Ayurveda and TBR College and Hospital, New Delhi. Namaskar, welcome you, sir. Next, I want to welcome Dr. Ramakant Jadhav, Associate Professor, Department of Kaya Chikitsa, All India Institute of Ayurveda, New Delhi. Welcome you, sir. Next, I want to welcome Dr. K.C. Priyadarshini, Consultant Surgeon, Gompha Vikranamarsi, Ayurveda Teaching Hospital from Sri Lanka. Welcome you, madam. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening important webinar, prostate enlargement and Ayurvedic treatment. Namaskar, over to Pavanji. Thank you.
धन्यवाद, बहुत बहुत आभार सर आपका। ये आज की सबसे बढ़ती हुई प्रॉब्लम है कि हम लोग प्रोस्टेट के उपद्रवों से जूझ रहे हैं। प्रत्येक बुजुर्ग कभी न कभी थोड़ा बहुत इसके कष्ट पाता है। अब वो आयुर्वेद का कितना रोल होना चाहिए, आयुर्वेद क्या केवल सर्जरी से ही तो शल्य से दूर कर सकता है, या आयुर्वेद में कोई दवा भी है जो इनिशियल स्टेज पर उसका ट्रीटमेंट करके शांत कर सके? तो क्या शोधन जरूरी या शमन जरूरी? ये एक सभी के माथे में प्रश्न अपने आप गूंजते रहते हैं। इन्हीं प्रश्नों का उत्तर देने के लिए आदरणीय के सिजोरिया जी, रमाकांत यादव जी and Priyadarshini ji is with us, and we would like to request all the speakers to kindly, as much as possible, communicate in English, because Dr. Priyadarshini ji doesn't know Hindi well. So it is our humble request to all, number one. Number second, please join our Kutumb app. Please subscribe our YouTube channel. This is absolutely non-commercial, non-profitable, and non-donationable journey of brainstorming and knowledge sharing. So please support us by spreading our message to maximum persons, maximum Ayurvedic experts. Thank you very much. I would like to request Professor V.K. Agnihotri sir and then Professor K.K. Sejoria sir. Welcome, sir.
Thank you, Professor Pawan Sharma ji. Namaskar to all the dignitaries and also all the guest speakers of today's webinar. Very special topic, that is prostate enlargement. Being male, it's always, as Professor Pawan Sharma ji told, that it becomes a problem, of course, after 40 and especially 50 to 60s age duration. Say, when it is known as Paurush Granthi, it itself reflects the malehood itself rather, and really very responsible. Its secretions are very responsible to maintain the pH of semen and sperm. So we will be getting the progeny, but at the same time, on its enlargement, it becomes a problem for especially for proper maturation, and the post-void volumes remains there in the uterine, this urinary bladder, resultantly that gives a repeated sort of infection and all that. So today's enlightenment regarding this issue will be a great success of our Ayurvedic system of medicine, that if it is Raktaj Vyadhi or Rakt Dushti or Mans Vyadhi, Mans Dushti, then anti-inflammatory, blood purificatory preparations like cashew gugulu and etc. So anti-inflammatory, whatever they will do. So two persons from our male sides, Professor K.K. Sejoria ji, welcome sir, and Professor Ramakant Yadav ji from AIMS, IRES, welcome. And at the same time, Madam Professor K.C. Gunaratne ji of Priyadarshini ji, of course, from Sri Lanka, and female, but she is surgeon. So she has got full right to comment upon its say importance regarding the BPH or simple enlargement and its possible either surgery or conservative treatment. With all these initial remarks and say greetings, I would also like to welcome our very near and dear friend, Dr. Mr. Triveni Chand Shukla ji, who has just joined after a long gap from Vadodara, I think. So welcome, Dr. Triveni Shukla ji. And
thank you so much. Thank you so much.
And all the dignitaries who have joined our platform, and those who will visit our YouTube also, and also the archives. So thank you so much, and we are most eager to know much more regarding the prostate enlargement and its Ayurvedic management. Thank you, sir. Over to Sir Pawan Sharma ji. Namaskar.
Thank you very much, sir. One humble request I would like to do with Ramakant Yadav ji. As Dr. Priyadarshini ji has to go to at 9 p.m., I would like to request him after K.K. Sejoria sir. So please cooperate with us. Well, so I would like to request now Dr. K.K. Sejoria ji. Welcome, sir.
Am I audible?
But it should be slightly louder, sir.
मैं ऑडियो आवाज आ रही है पवन जी? मेरी आवाज आ रही है?
कम आ रही है, आ तो रही है सर, लेकिन कम आ रही है.
नहीं आ रही आवाज मेरी?
It's a dim. It says you please increase the volume.
पूरा है प्रभु, पूरा है, वॉल्यूम तो पूरा है इसमें.
क्योंकि उससे डिस्टेंस ज्यादा है, आप थोड़ा सा नजदीक से थोड़ा सा, या तो ईयरफोन यूज करिए सर.
आवाज आ रही है मेरी आवाज? आ रही आवाज यादव जी?
सर आ रही, पर थोड़ी स्लो है सर वॉइस, वॉल्यूम लो है थोड़ा.
पूरा है, नहीं आ रही. वॉल्यूम फुल है. आवाज आ रही है पवन जी?
उसका माइक पास में ले लीजिए ना, उसका माउथ के पास.
आवाज मेरी आ रही है?
Yes, wonderful. It's quite fine, quite fine.
Yes, loud and clear.
Yeah, thank you.
Actually, I was not aware about my topic today. Pavanji said yesterday I have a talk. He told me send your photo. I am a listener. No problem. Nowadays, just I am talking 1977 when the work on prostate was started in the Banaras University under the guidance of Professor Deshpande by me. Role of मतलब मैं भूल गया रेस्पेक्टिव ऑल दी पर्सन स्पेशली सीपी शर्मा जी, पवन जी, अग्नोत्री जी, शर्मा जी, यादव साहब, इन सबको मेरा नमन प्रणाम, सभी को भैया श्रोतागणों सबको मेरा नमस्कार, आदाब, सलाम, नमस्कार, जय हिंद। आज का टॉपिक मैंने पवन जी, आई सजेस्ट डॉक्टर पवन शर्मा जी, दिस इज वेरी इंपॉर्टेंट वाइटल टॉपिक since you will surprise know in 1977 first I got the opportunity on this topic under the guidance of Professor Deshpande Sahab when there was no ultrasound. Role of Barun Quat in the obstetric uropathy, especially on the prostate. First of all, we want to know, everybody knows what are the causes of prostate. Nobody knows exact rule. What the rule? Somebody says it due to the imbalance of hormones, especially as age advances, the level of estrogen increase and testosterone down. But in Ayurvedic references, when we go, it comes in the Batik rope, especially Asthila. When we go Asthila, we got all the symptoms like the prostate. Later on, somebody defined as pores granth vridhi, a prostate enlargement. So, in prostate enlargement, when we see the symptoms, the patient comes with the frequency of maturation, dysuria, and the frequency, nocturnal frequency is more. And sometimes patient may come with the atonia bladder, which in the prolonged cases. Sometimes he may come with the hematuria also. And sometimes the patient will also complain with the frequency, hematuria, nocturnal frequency increase, dysuria, infection also. And sometimes we can find some pouches also which contain stones, also which known as prostate stones.
सर आपकी आवाज फिर थोड़ी कम हो गई है, प्लीज थोड़ा करिए, पहले ठीक हो गई थी।
So these
yes, yes, ऐसे रह गया। Thank you sir, thank you.
So from these symptoms, patient will come to you. How we can diagnose? Nowadays, lot of tools are available. But previously, we used to diagnose by the digital diagnosis. Before this going to diagnosis, we used to clear bowels. Since in this prostate problem, I have seen generally there is history of constipation also. After clearing bowels, patient is left lateral position or knee position. We pass the fingers and we see the exact condition how much prostate enlarged. We can make enlarge grade 1, grade 2, grade 3. If we are passing the finger up to prostate, we can say it is grade 2. Or just you can just make it a division like your own choice. If it is more than 3, we can't feel the upper wall of prostate. When we also examine the mucosa's position, is it by friable or hard or soft, whatever. Nowadays, we at that time, olden time, there was no X-ray. There was only X-ray, by which we can diagnose by passing the this much erythrography. By we pass some this iodine solution, the prostate, we can find some cap-like deformities there. But nowadays, ultrasonic study is also available, and CT, MRI, a lot of tools are available by which we can diagnose. But important cause is that how much we are having our own limitations. I have seen personally in prostate. First of all, such patients should be diagnosed properly. After diagnosis, we plan the treatment. In treatment, I am saying my own experience. I started Basti therapy. In Basti therapy, I take the Basti therapy as well as some oral drugs. In oral drugs, I took Goksha Gugul, 2BD, and this Silajit tablet, या Chandravati. And this Basti therapy के लिए, I have taken only Barun Kasai and the Smool and Naran Tel Basti. Before preparing the patient, just we pass the catheter and we mix the 50 ml Naran Tel, lukewarm, and 200 ml Barun Kasai and make in the drip, like drip set. Bottle say we connect the drip with the bottle and slowly we pass out this. After making slight massage on the umbilical area and left lateral position, we pass this medicated cloth with oil in the anus rectum within 20 or 30 minutes, slowly, very much slowly. After doing this much, after making this 13 sittings or 15 sittings, we just check the position, prostate. I have seen it personally in the first grade and second grade is very much effective. And I have seen such patients, we were on catheter, they were also improved. But if it is more than, if this position is grading is more than 2, then surgery we can't go for this medical treatment. We should go for surgical treatment. As Susita also indicated, if diseases are chronic, if you're not going to perform surgical treatment, patient may go in trouble also. He has mentioned also akriyam dromitu kriyam sansobhavet, because it has been seen in the sometimes in prostate there is hydronephroid change also due to obstructions. Besides this, patient may also hematuria. So you give just oral therapy and this Basti therapy, you will find this dramatic changes in prostate enlargement. This is my few. This is my study which I've done, and beside this, I have seen tone of bladder in prostate cases. The tone of bladder is also disturbed even after prostatectomy. 90% cases I've seen the bladder loses its tone. In such cases, this Barun Kosai is very much helpful because I have seen it personally. Karke dekha, I can assure if you give the Barun Kosai 20 ml BD for 1 month or Bistundukbati, I assure you this is very much helpful in maintaining tone. So this is my few observation during my time, and still I am doing this Basti therapy. Results are very much encouraging, but in the prostate is very much high, and this changes. I don't change also. Then we should go certain for the choice, not rather than this surgery. Surgery is a choice of treatment. We should not depend on medical treatment. Go for surgery. Thank you very much. This is my certain observation during my time. Thank you very much. Now I am listening. The Baki rest.
Thank you very much, sir. Thank you very much. So now I would like to request Dr. KCP Gunaratne ji, Dr. KC Priyadarshini ji, welcome. Welcome.
Yes, sir. Good evening.
Good
So I'm
evening.
in a power cut, so I'm going to stop my video. That is not nice, sir. So now I am sharing.
No problem, madam. Welcome, welcome. You are co-host, you can share anything.
Oh, sir. Yes, sir.
Unfortunately, my WhatsApp is not being connected yet today.
So I think you can see my presentation. Sir, can you see?
Yeah.
It's very clear. Are you Bhuvan?
Yes, sir. I want.
I have one.
Good evening, sir.
Good evening.
All respected dignitaries and all other participants, I am mostly welcome you all for my presentation today. Actually, I have to ask you your pardon because I am in dark, so you can't see me, but still I can do my presentation. So actually, why I am going to present this? Because in my clinic daily I am getting more than 5 to 10 BPH patients. But the thing is, I have to tell, they are not only old people, but I have around 20 to 90 age people normally. That means some very young boys also having the same problem. I don't know what's the exact reason behind that. So I want to share my experience since around 7 to 8 years. So this is the bird view of my topic. We'll move to the topic. Then what is the Mutra Ashtila? So the thing is, in Ayurveda text, we are telling about Mutra Ashtila. That is the growth or turn on produce obstruction to the passage of with the Mutra, Anila, and leads to Admana of the Basti and also pain in the region of Basti because of the swelling of prostate or the area of the prostate, but we are telling in allopathic way. So the thing is, the name of Ashtila is given by Charaka for the disease vitiated by Vayu, obstruction the Basti, Mukha and Guda, leading to prominent mobile stones like mass, which is in the turn cause obstruction to the passage of urine and feces. The thing is, we all know what is the prostate gland. That is the it is just below the bladder and upper part of the urinary tract. So the thing is, what kind of nidana is for this? Because we have to see, but the thing is, in our text, they are not given the direct nidana that ancient acharya have not mentioned, but still we can go through with Mutra Gata Nidana as for Ashtila even, and we can see the Mutra Krucha Nidana also for this. So what kind of especially what are the nidana? That is Tikshna Aushadha, then Ativyayama, then Adhyashana, then Anupamansa, then Ajirna, then Ruksha Madhya using, then riding on horse or moving animals likewise. Then what are the Mutra Vaha Soto Dushti etiology? We have to see. Then here they have mentioned Sri Sevana, then Sheena persons, then Mutra Nigraha, then Abhikshata, then drinking and eating while urge of maturation. Then all above nidana are responsible for vata dushti, root of factors in the manifestation of all the varieties of mutragata. Then according to Dalhana Acharya, sarveshu mutragateshu yato vata vaha karnam, they have said like this way. Then what is the samprapti of mutragata? Acharya Sussuta states that importance of pratiloma vayu is the basti roga such as mutragata, prameha, shukra dosha and mutra dosha. Then Acharya Dalhana quoted that vata is the main factor in the pathogenesis of mutragata. Then Acharya Charaka states that when the amavisha gets localized in the urine leads to mutra roga. Then what kind of diseases with obstruction of urine passage? Because that vata ashtila also having the main problem, the main complaint with mutra gato obstruction. Here the other varieties are Nirudra Prakasha, Ashmari. Then under mutra gata they are having a lot of, but under all these 12 varieties, one is vata ashtila. Then what is the samprapti of ashtila? Mityahara and vihara and o abhigata o vega nigrahana. Then because of that apana vata dushti, then it will lead to sthana samshaya is between guda and basti. Then astivat gana granthi, its form. That means it is somewhat hard granthi form around the urethral orifice, urethra, top of the urethra. Then mutrashila with all the lakshana. Then what is the samprapti gataka? What is the samprapti gataka? Then the dosha, prominent dosha is vata and other dosha also. Then dusha, rasa, rapta, kleda, sveda, mutra. That is dependent on the different clinical entities. Then agni, jatara agni mandya. Then uddavasthana koshta, adhisthana basti, srotas mutravaha, sroto dushti prakara, sanga, vimargamana, sira granthi. Then rogamarga madhyama, vyakti during the action of maturation. Then what are the prostate enlargement main entities? If not, what are the abnormalities? In all these three, that means prostate cancer also, prostatitis also, then benign prostate hypertrophy or BPH also, they are having prostate enlargement. But the thing is, according to their problem, the symptoms may be vary. Then voiding or obstructive symptoms. What kind of symptoms that patients will present? Mostly they are telling to strain to pass urine. Then other one is hesitancy. Then sometimes they will tell prolonged micturition. Then poor stream. Some are telling they can't pressure the poor stream and they will get the stream next to their leg even. So then terminal dribbling. Then intermittent stream. That means they are having toothy streams with some blocks in between. Then sense of incomplete bladder empty because that enlargement or that swelling in the prostate, some are telling they are having some residual volume. Because of that, sometimes they will get another urge soon after once micturition. So they are having incomplete bladder emptying. Then what are the irritative symptoms or storage symptoms? That is urine frequency. Mostly they will get higher frequency in the night than daytime. Then urgency. Then dysuria. Because sometimes they are having so long that remain urine, they will get some infections. Because of that, they will get dysuria. Then sometimes involuntary night urination. That means it's not voluntary. Sometimes involuntary urination also can happen. So a lot of people, they are getting recurrent dysuria, and because of that, they will suffer a lot. Then what kind of examinations we can do? Especially we can get the good history, because a lot of patients come and tell their problems. So next, we can see the physical examination. That means DRE or digital rectal examination. I think previously also explained that was very nicely. So while we are doing digital rectal examination, what kind of things we can see? One is size and consistency of the prostate. Then the surface, whether it's smooth or convex. If surface is very irregular, then we have to see whether it is a prostate cancer or it's a benign form. Next one is consistency, whether firm. Then sulcus palpation in the middle between the two lobes, because if that sulcus is moved to one side, then we have to see other reports, and we can understand one lobe has enlarged than other one. And BPH result in a smooth, firm, elastic enlargement. Prostate size, as determined by DRE, does not correlate with severity or symptoms of degree of obstruction. That means while we are doing DRE, we can't see the severity. For that, we have to take the proper history, and we have to see other reports even. And other one is we can estimate the obstruction actually. So next, we can see other investigations also. One is imaging. That means we can go for pyelogram. If not, we can go for USG. That means ultrasound sonography. Then we can see the other associated problems. That means the urine calculus, or what are the other calculus, any other problems, what are the things associated with this. Sometimes they will have hydronephrosis even. So at that time they will mention, and from that we can see prevoidal volume of urine and postvoidal volume of urine. From that we can understand whether they have to go for the surgery immediately, or we can treat. It's taking some time. The same time we have to see the PSA. If not, this is prostate specific antigen, because without see the PSA, we can't diagnose whether it is benign one or the cancerous one. So if it's going to be a cancer, then we have to send the patient for the emergency surgery. If not, we can take the time and we can do the treatment. Same time, we have to do the urine analysis also, because I told earlier, a lot of patients, they are having dysuria. So we have to see what are the quality of urine, and whether they're having other deposits or something, whether they are having microorganisms. Then we have to consider about their urine problems also, and we have to do the treatments also for them. Then we have to see the serum creatinine level also, because long-term prostate sometimes can be affect the kidney functions also. So further, we have to see the urofluorometry. That means we can see the velocity of the urine flow, because a lot of them, they are telling they are having poor urine flow. So while we are doing the treatment, we can see whether any progress or not with urofluorometry report. Then urethrohistoscopy and postvoidal residual estimate, and prostatic acid phosphate, that means PAP. Likewise, we can do. Then we can do that TRUS, that means transrectal ultrasound scanning. Likewise, lot of reports we can see, and we can confirm the problem. That means first we have to see whether it is a prostatitis or benign hypertrophy or the cancerous stage. Then while we are doing the chikitsa, we have to go for mutragata chikitsa, because earlier also we mentioned they are not given that direct reference. So we have to follow the general treatment for mutra dosha. So we have to do Snehana Karma, Virechana Karma, Svedana Karma, and Uttar Basti. Then what kind of management we can go for Ashtila in detail. Here also we have to see the Agni, and we have to do the Agni Deepana if necessary, then Nama Pachana, then Vata Kapha Shamana Chikitsa, that means for Daihika Chikitsa, then Basti Karma, as previous mentioned, we have to do classical Basti, or Matra Basti, or Uttara Basti, or combination according to the situation. Then Sthanika Snehan, because a lot of time they are getting that obstruction of urine. That means they have to force to do the urination. So we can do the Sthanika Snehan. That means oil application to the lower abdominal area. And we can ask Sthanika Sweda even. Either Pottali Sweda or Nadi Sweda with essential drugs. Next, what kind of actions we are expecting from these medicines? Vata Shamana, Shotahara, Lekaniya, Mutra Karaka, Mutra Shodaka, Grantihara, and Kapha Shamana. These are not mentioned separately Chikitsa. Mutra Gata Chikitsa and Granth Chikitsa we can do as a combination. So we have to go for Sneha Karma, Svedana, Basti, Uttar Basti, Ashmari, Nashaka Chikitsa. Because we all know while they are getting prolonged urine retention, they may get Ashmari also. That means Mutra Ashmari or Shukra Ashmari even. Then because of that, we have to do the Ashmari Nashaka Chikitsa and Lekana Karma even. Because sometimes according to the Shalya or Ashtavida Shastra Karma, if not, we can do for Lekana Karma with medications. Then what type of common medicines we can use for all these? So we can use some Kasaya, Kalka, Tarpi, Leha, Paya, Kshara, Madhya, Asava, Churna, Taila. Then what kind of Kashaya we can use? That all previous also mentioned that Varunadi Kashaya, that is very effective Kashaya, and Eranda Bilvadi, then Dantimuladi, then Dashamul Kashaya, they are very effective. Then as Churna, we can use Tripala Churna, Sayushnadi Churna, Gomutra Haritaki Churna. Then what kind of Taila we can use? We can use Nirgundyadi, Narayana, then Vata Viduranga. These both for local application, then for what kind of bastis we are using, for that also we can use either only Thailo, we can do Kashaya Basti also with this oil. Then what kind of Vati we can use? That Kanchara Gugul mostly we can use. Then Chandra Prabha Vati, Kokshura Gugul, Yogaraja Gugul. From these we can use as for Lekana Karma or some Mutra Karaka or Shotahara or Vedana Shamana. For that all purposes we can use these Vatis according to their symptoms. Then what kind of Sarpi we can use? Baladigrita, Mahabaladigrita, Chavyadigrita, Varunadigrita. Arishta, Kutajarishta, Abhyarishta, Dantyarishta, etc. actually. Then these are the Shira we can use. Then these are the Shara. That means Patala Shara, Patala Yavakshara. Likewise, lot of combinations we can use. Then Sura also we can use. Likewise, lot of medications actually according to the situation we have to do the treatment. Especially previous what he told, I also agree for him, because lot of patients also, I am also starting with the Basti. From day one even, I am starting with Matra Basti with Narayana Thaila or Nirgundi Thaila, mostly around 30 ml per day. Normally I am using once in a week because they are only OPD patients, but if we can do daily, I think it will get more benefits for the patients. And the oil application for the lower abdomen with Sthanika Sweda, either Nadi Sweda or the Pottali Sweda. they are giving very good result, because sometimes while they are within obstruction of micturition, at that time also if they do that Thaila Abhyanga and Sweda, then they will get easily that micturation flow, because sometimes they have to strain few minutes even. Some have told me around 3 to 5 minutes they have to strain. Sometimes they have to pass with blood. At that time they will get afraid to do the micturation even. At that time, if they are doing that oil application, that will giving more benefits. Then Upadrava, what kind of Upadrava or Arishta Lakshana they are getting? If the pain of Vatashila or Mutrashila moves upwards toward heart, causing pain and anorexia, it all indicates death beyond doubt. Because sometimes, because of that Vata obstructions, that Vata will go upwards and it will cause the heart. Then because of that, they will get the pain and anorexia. That means mostly indicate death. So what kind of complications if they are getting BPH? Not only BPH actually, because of prostatitis even, sometimes because of cancer of prostate even. Actually now also I am having this all kind of patients in my clinic. Up to now I have prostate cancer patients also these days. So I am treating sometimes with the help of allopathic medicine even. But the thing is that sometimes they are getting very good relief with symptomatic relief, or because while we are doing Amapachana and Agnidipana also, they are getting lot of good relief from their problems. So what are the complications? Then retention of urine, maybe acute or chronic. Because of that, they are suffering a lot. So they can't concentrate their work, they can't go out, they can't work, they can't sleep even. So they are suffering a lot. Then recurrent urinary tract infections. Earlier also I mentioned. Then bladder calculi. Lot of patients coming with bladder calculi with history of BPH. Then secondary bladder instability. Then renal impairment. Then hematuria. Some patients, they are not passing urine and they are passing only blood, because that much obstruction they may be having. At that time actually we have to do the catheterization immediately, and we have to allow them to pass the urine. If the normal urine catheter we can't do the catheterization, we have to go for suprapubic catheterization for immediate relief of their problem. If not, they will get such a big pain they can't tolerate even. So what kind of patte we have to prescribe then? Then Abhyanga, that means oil massage, they can do that daily at the home even. Then Snehana, that means they can do the grita or oil, that means they can drink. Then Virechana Karma, that means oily purgative are more preferable. Then Basti, retention and evacuation enema, that means we can do very nicely with that Matra Basti. Then Uttara Basti, then Svedana, that also they can do at the home even. Then Avagaha, sometimes I have given them to Panchavalkala Avagaha to relieve somewhat because of their UTI problems. They are getting some relief. Then what kind of benefit diets we can ask them to take? Cereals, more than 1 year old rice, meat, jangala mamsa, milk, especially buttermilk, curd and other products. Then pulses, moong, masoor, then vegetables, snake gourd, kushmanda, fruits, tender coconut, dates, coconut, grapes, such like these things. Spices, especially ginger, garlic, vinegary seeds. Then wines, medicated wines, Sura, Asava, and Arishta. Then cereals, milk, pulses, meat and milk products should be taken in sufficient quantity. Then common herbs, what we can prescribe for Ashtila. Then Varuna, Kanchanara, Patla, Pashana Beda, Methi, Shilajit, Ashwagandha, Kokshura, Khadira. Here also, why we are giving Pashana Beda, especially for Mutrakaraka and for Ashmari Bedana, because while we are using these all medications, we are not only treating for symptoms, we are giving for that Nidana Parivarjana also, then symptoms also. Sometimes we have to treat for Upadrava also. So we have to use such kind of medicines. Then what kind of apatya we can ask patient not to take, then Viruddha Ahara, especially excessive exercises, food leads to constipation. Because of constipation also they are getting water excess. Because of that they will get such problems. So we have to ask them to not to take constipated foods. So suppression of micturition. Lot of patients, they are not having enough time to do the micturition even. So we have to ask them to do the micturition, and they have to spend sufficient time for micturition. That means they have to try to do the bladder full empty at that time. If not, they will remain some urine, and they will lead to problems later. Then excess sexual activities, then they are not good to take tiller, meat of deer, offshoot of bamboo, etc. Then dry and fermented food items. That means we have to ask them to not to take that Vata Kopakara foods. Then lifestyle measures for managing especially BPH and other prostate problems even. That means because of our lifestyle also, we are precipitating their prostate problems. So we have to ask them to urinate as soon as urged. Then remain sexual activities, then take time to empty the full bladder, what I told earlier also. Drink sufficient water daily, because they are having that urine retention, it may be leads to UTI. So for flush out, they have to take more water, then do pelvic floor muscles exercises. Because of that, then that maybe the pain will relieve. If not, they can pass urine without strain that much. Likewise, then keeping warm and exercising. That means they have to keep their body warm, because the Vata aggravated and the Kapha aggravated problem is the prostate. So if they are keeping their body warm, then that Vata and the Kapha will pacify naturally. Then bladder retaining by using time voiding. That's what I earlier told. Then maintain voiding diary. So they have to make a timetable and they have to do the voiding, and control stress and reduce mental stress. Because of that stress also, they will get Vata Kopata. So they have to mentally also be a free person to avoid these problems. So better to avoid more liquid intake close to the bedtime, because a lot of patients, they are telling nocturnal urine. So not to take that much liquids in the bedtime, better to take in the daytime. Then excess alcohol, coffee, tea, not to take. Then medicament that aggravate the symptoms, and sometimes because of they are taking other medications, they will lead to such problems. Then food leads to constipation and cold temperature, they have to avoid. Then summary, ancient Acharya have not mentioned any specific causative factors of Mutragata. Factors which are responsible for Mutra Krucha can be considered. Then Acharya Susita said that the importance of Pratiloma Vayu in the Basti Roga, such as Mutragata, Prameha, Shukra Dosha, and Mutra Dosha. Acharya Dallana quotes that Vata is the main factor in the pathogenesis of Mutragata. Then Acharya Charaka states that when Amavishta gets localization in the urine, leads to Mutra Roga. The vitiated Apanavayu, when takes the seat in the space between Basti and Shukra Marga, produce firm tubulated growth like of Ashtila. The growth is turned to the produce obstruction to the passage of with the Mutra, Anila, and leads to Admana and the Basti, and also pain in the region of Basti. In the conclusion, prostate abnormalities occurs due to Apanavata Dushti. Mutrashtila separate chikitsa not mentioned. Mutragata chikitsa, Ghanth chikitsa can be adopted. Treatment can be done with many of type of medicines, and following Patyapatya Ahara and Vihara is more essential. So thank you very much giving me the time. Good night.
Excellent, excellent, Dr. Priyadarshini. You have covered almost every aspect of the prostate and enlargement, benign, cancer, everything. You are inspiring as always. Thank you very much. Thank you so much for
Thank you,
joining us.
sir.
And please do join whenever you have time and topic of your choice. Please do
Sure,
join.
sir. Sure, sir.
So nice of you. Agnihotri sir.
Thank you, Professor Sharma ji. Thanks a lot, Madam Kesikunatne ji. Actually, first of all, you managed even in the absence of light itself, as you told that there was electricity breakdown. So definitely you might be managing the prostate problem also of your patients as they are coming in number of good number in your OPD. But could you manage to see that why the early age group, say 19-20 years old boys are coming with this problem? Have you got any doubt, any etiological this thing? We can discuss afterwards because our Professor Yadavji is waiting. But as you have to leave within 5 minutes, so if you can put one sentence light over it, or you can think of it regarding the early age involvement.
So I think that may be a genetical problem. So birth abnormalities.
Genetical problem. So it means the population of that sector is genetically involved in that abundance in number. It's you can go on thinking on the all other factors also, especially the diet itself, because today nowadays the persons are taking early young chap are using this fast food and all that thing. It might be leading to some sort of congestion or repeated UTI, etc., which may cause ultimately this prostatic problem. I think. You can
Because of their, I think, busy life, even because they are not giving time for maturation, even they are maintaining their that urges even.
Right,
so they are not drinking proper water, and actually what you said is correct, sir, that food is not taking properly. Likewise, that the youngest one is around 23 years, sir. Yeah. That my patient was 23 years.
I think riding on bike for say a couple of kilometers, say 20-30 kilometers, going and coming either for schools or for job, that might be continuously a pressure over the perineal region, which may lead to the say congestion to the prostatic urethra.
Yes, sir. Maybe because earlier I had one patient.
Thank you, because we have to take our next guest speaker, Professor Yadavji, and he will also remain with us, and we will be having a good discussion with rest of our guest speaker, including Professor K.K. Sajuria ji. So over to Pawan Sharma ji for further.
Thank you very much, Agnihotri sir, and Priyadarshini ji. Thank you very much. Now I would like to request Professor Ramakanti Yadav from All India Institute of Ayurveda. Welcome, Dr. Yadav. This stage is yours, and now stage is yours forever. So please consider this stage as yours and try to invite like-minded people who are really interested to share the knowledge. Welcome.
Thank you, sir. And respected my teachers, Professor V.K. Agnihotri sir and Professor Sajuria sir, and other dignitaries and other speakers who have joined this program today. I could see Dr. Dineshwar Prasad sir has also joined from I think Patna. Now he has been recently retired from government services. Now he might be feeling very easy and for him. So welcome, sir. And at the outset, I would like to give my regards and my gratitude to Dr. Pawan Sharma ji for inviting me to this platform. And definitely, sir, as you have told, I would like to be with you in near future also. So definitely this topic, since I used to deal with the Kaya Chikitsa department, so this topic is really a very specific topic, and I think Professor Sajuria sir and Dr. Gunratne have already explained lot of things, and they are really so because they both are dealing with the surgery department. But somehow I would like to talk within my own limits. Let me share my screen first. Sir, is it visible? Sir, screen visible है sir?
Yes, yes.
उसको फुल साइज कर दीजिए.
ठीक है सर, स्लाइड शो पे कर देता हूँ. Yes. With this, I would like to discuss the benign prostate hyperplasia with a special reference to Vata stela, as already told by Dr. Sijoria sir and Dr. Gurunatne madam. So definitely, as everybody is saying that lifestyle disorders are now a major concern. I think it was about a couple of decades back when we are really worried about the infective disorders, and most of the population was suffering from the infections. But nowadays, it has been evident that infective problems are really not bothersome that much. And now the lifestyle disorders like diabetes, hypertension, and arthritis, the benign prostate hypertrophy, and many more, they are causing more concern to the individuals. And also, the life expectancy has also increased due to the availability of treatment facilities. So that has also become a problem, since the old age population is getting more and more. So such type of problems are definitely coming to our life, and we will have to face that problems also. Definitely, a lot has been said about this introduction of the benign prostate hypertrophy. I will not go to very much of details, but if you say that definitely bladder outflow obstruction, this is the most important factor which has to be taken care of, because it tends to, you can say, decrease with the if a person is getting older and older. And coming to the prevalence, you can say it has been observed around 8% to 50% and 80% in fourth decade, sixth decade, and ninth decade, respectively. If you say, then there is a chance, increased chances of prostate hypertrophy are there. And the studies suggest that the prostate volume increases with age, having growth of rate 2 to 2.5% as per the older men. Definitely, this is maybe considered at the problem of old age, but just Professor Agnihotri has said that though there is no direct relation is evident in any of the classics regarding this happening in the younger age group, but one of the major causes, as it has been also pointed out, is vague growth, that is mutra ka the to cessation of the mutra veg. So that is maybe a one of the reason for if a person is a traveler, and he or she may use to retain her or his urine for a longer period of time, ultimately causing this prostate like hypertrophy in male population. So such type of incidence may be related to the incidence of benign prostate hypertrophy. What happens as in picture, you can see that there is progressive enlargement of prostate and progressive obstruction of outflow of urine, and you will see that the epithelial cells of stromal tissue start such type of obstruction you can say in this picture. There is a gross, you can say, obstruction, and ultimately the size of prostate increases and the urine flow is obstructed to a great extent. And many times the detrusor muscles that can have some kind of anomaly, and that may also lead to the prostate like condition. Coming to the there are mainly two theories which are more popular about this benign prostate hypertrophy. First is hormonal theory that says that with the age testosterone drops slowly, but fall of estrogen level is not equal. So prostate enlarges through intermediate peptide growth factor, number one. And number two, neoplastic theory. There is a proliferation of all elements of prostate like fibrous, muscular, and glandular, resulting in fibromyalgia. So such type of causes are really described, but not very specific causes are till date are known to the scientific fraternity. What are the major signs? I have definitely my job has been really done easy by the our earlier speakers. There is a reduced force of urine stream. There is difficulty in initiating voiding. Intermittency is there, dribbling, and at the end of urination. That is, and many times this increases, frequency increases during the night time. And what may be the, if you classify the symptoms, irritative symptoms like frequency, urgency, dysuria, bladder pain, nocturia, incontinence. Such type of irritative factors are there. What are the risk factors? As in Ayurveda literature also, Madhya and other things are which are having ruksh in nature are described. So is in modern medicine also. If you go through that chronic smoking, heavy alcohol consumption, such type of diseases are also described for this causing of benign prostate hypertrophy. Apart from that, many heart diseases and diabetes may be considered as some of the factors which are responsible for early onset of prostate hypertrophy. What may be the complications? Acute urinary retention may be there, urinary tract infections may be there, renal stones may be there, bladder damage may be there, hydronephrosis may be there, pyelonephritis may be there, because pyelonephritis because there is retrograde pressure due to obstruction, and that affects up to the level of kidneys. So that ultimately causes pyelonephritis. And differential diagnosis is must. So we have to differentiate from other obstructive uropathies with this benign prostate hypertrophy, like the stricture of urethra, neurological causes of retention of urine like diabetes and disseminated sclerosis, Parkinson's disease, tumor of bladder, and carcinoma of prostate, and idiopathic detrusor activity. So this is kind of involvement of muscles of the bladder. So such type of condition may also be you can say excluded for, or has to be diagnosed properly. And very thoroughly diagnostic techniques are stated by our earlier speakers, like taking history is very important. For rectal examination is digital examination, that is very important. Urine analysis, culture sensitivity. Most important is prostate specific antigen, that is PSA, and it demarcates the whether it is a benign or it is malignant. And transrectal ultrasound, this is a good technique. Uroflowmetry, measure post-void residual volume, and cystourethoscopy. This may be the diagnostic tools which are available for the diagnosis. But in older times, I think today also this digital rectal examination is most important. That thing is exists. Coming to the management, no, I'll not focus major and also not mentioned the trade names of many medicine, but I have mentioned the groups what modern medicines which are used, like 5-alpha reductase inhibitors and alpha adrenergic antagonists or alpha blockers, and muscarinic receptors antagonists like MRAS or combined therapies. Such type of medicines, you can go through this pharmacology and you will get the trade names of such type of medicine. So these are the common medicines which are nowadays used by our modern practitioners to some or other effect. Now, what Dr. Sijoria sir has also said that we should definitely go for surgical operations. Definitely, being a surgeon, his utmost priority is that. So, what is gold standard nowadays? That is TURP, transurethral resection of prostate. That is a gold standard for surgical treatment. And other is HOLEP, that is Holin laser nucleation of the prostate, green light laser therapy, prostatic urethral light, prostate artery embolization, and robot-assisted simple prostatectomy. These are surgical techniques. I think surgeons are more experts for talking on these things, but I have just named the techniques which are now being used for the operations. Coming to the next part, that is what we are here to talk about, that is regarding the Ayurvedic. What are the recent advances in the Ayurvedic management? So I will focus on the causes of Mutraghat. Definitely, Mutraghata, Mutravrodham, Mutraghaten, Mutram, Shoshite, Parihantyeva Ghat. So what is important, that is Vibandho Balwan. One thing I would like, Vibandho Balwan, Krichatvam Alpam Iti. This is the most important symptom, which is of everybody should focus on this, because there is a gross decrease in the volume of the urination. So such type of symptoms are given in the definition. Nidana, I will not get to the Nidana, already explained by our speakers. But what one of the most important causes, Mutravahini Dushyanti. This is very important. And also Tikshana Oshadh, Ruksha Madhya. So such type of causes are also, which are really wonderful to see that all these are also mentioned by our modern literature and modern techniques also. This is definitely related to the Vatasthila. Everybody knows this is one of the types of Mutraghat. So what a good description you will find that and what is anatomical position, how wonderfully it has been described, like Granthim Karot Achalam Unnatam, Astilavad Ghanam, like stone, Sakrin Margam Vastescha, you can say between the rectum and the bladder. This is the, so how wonderfully it has been described by our ancient rishis and acharyas. So such type of disease ultimately known as Vatasthila by the experts. So mainly Vedana cha Paravasto, around the Vasti area, there may be some kind of pain may be there. Definitely no direct relation is there, but if there is continuous obstruction due to prostatic hypertrophy, a kind of retro pain may be due to pressure effect. So such type of wonderful description about the Astila is given. Definitely, what is Samprapti already told by our earlier speakers. Most important I will focus on. Number one is Vegdharan, I think. Number two is Prasthayana, that is what Professor Agnihotri sir has really mentioning earlier. Ati Vyayama, Rukshahar. So these are the most many things which are related to our lifestyle, and if that is incorrect, then definitely there will be some kind of obstruction nature of the Astila that will develop, and aggravated Apanvayu. This is already explained. and ultimately there will be a granthi-like structure that will cause called asthila. And definitely this is due to the apan vayu vikrati and will ultimately cause what it will call retention of mutra, that is urine, flatus, that is an apan vayu. Mal also can cause constipation if it is really enlarged, and also can cause distension of bladder due to reverse pressure. So such type of wonderful description are described in our literature. Samprapti Ghatak, as in every disease, as Acharya Charak has also told that it is not necessary to name each and every disease, but what is most important to identify what are the dosh and other Samprapti Ghatak. So that is very important, not only in the cases of Asthila or any Madhumeh or Promeh. Even the modern diseases like we have suffered a lot from COVID-19 like conditions, we should always try to make a kind of pathogenesis or samprapti ghatak of such type of disease also. Here also you can say dosh, ras rakta kled swed mutra, jatragni may be the, and coast may be the place. Adhishthan is Basti, Srotas is Mutrava. Such type of disorder already narrated by our earlier speaker. I will not go to details. Ultimately, Sadhya Sadhita, you can say what is prognosis, that is Kricha Sadhya. It is not easily Sadhya. So really prognosis is also mentioned on the basis of Samprapti Ghatak. Coming to the most important part of the presentation, that is how to treat what is the non-surgical. I will focus mainly on the non-surgical management of such type of diseases. So this is our you can say treatment protocol. Kashaya kalp sarpinsi bhakshan lehan payansi cha char madhyadva sasvedan bastis cha uttar sangita. So this is a kind of our treatment protocol. Really, what is Nidan Parivarjan, Shodhan, Shaman, Shastra Pranidhan, Rasayan, and Pathya and Apath. So this is a kind of treatment protocol, and we should follow these guidelines. And based on these guidelines, we have a liberty to use different type of medical medicines which are available with the Ayurvedic science. I would name some. There are references that are given in Ayurveda, like Swaras, like Nidigdikadi, Bhavaprakash and Sushut, Amlak, Kantakari, Kalk, like Mustadi, Abhyadi, Drakshadi. These are all classical references. You will say that earlier also narrated by our earlier speaker, like Pashan Vedadi, Gokshura, Devdarvadi, Shatavaryadi, Haritakyadi. There are a lot of preparations which are mentioned for the treatment of Mutraghat, and those preparations may also be used in conditions like Asthila. Churn, various churns are mentioned like Vyoshadi, Eladi, Praval, Pashana Vedadi, Pipali. Sneh are mentioned, already told that Balagrita, Mahabalagrita, Pashana Vedadi, Shudanshtagrita, many. So we have lot of liberty to use from any of the classical preparations which are present. Vati and Gutika like Chantaprabha, Gokchuru, Shirpak like Kakulyadi and Trikantaka, Shar like Patla, Patyalyadi. Every medicine, name any medicine, we are having all the preparations which are available. What is important to apply according to the condition. So, Panyok like Punarnavadi, many conditions are good. Upanaha, Yavagu, Basti, such type of preparations are mentioned on the basis of principles. What now commonly we use in those are the classical preparations, but nowadays in common practice, what we use commonly are these major medicines like Varunadikvat we are using, Kanchanar we are using, Gokshuradi you are using, Punarnavadi Gokulu we are using, Chandpravati we are using, and Dashmulkvat. These are the most common medicines which are being used nowadays for the management of prostate hypertrophy in different conditions. Though there I have named classical only, but there are many patent preparations which are manufactured by our leading companies are also of very much use in such type managing such type of conditions, but I have not mentioned their names. Pathya and Apathya, definitely this has already been described, so I will not go to detail like Abhyang, Swedan, Basti, Avga, Swed, Uttar Basti. This is very important. Matra Basti and Uttar Basti. And Apathya, definitely Viruddha Anna, Viruddha Ahar, Veg Dharan. I think most important is Veg Dharan. Veg Dharan is the most important. We should always avoid a kind of Veg Dharan to remain healthy. Definitely, role of this Uttar Basti is what is in Charak. It has been described as Shrestha Chikitsa for such type of conditions. So you can say definitely here I would like to give a quote of one of the example of my grandfather who he was suffering with benign prostate hypertrophy, and we have given him Matra Basti. Uttar Basti, we have not given him Uttar Basti, but we have given a Matra Basti of Dashmul and Varunadi Kwat along with Maharan Tel. And then after giving Basti for a period of 3 weeks, he got such a wonderful relief that he didn't retain urine again till his last period. So such type of wonderful results are also found with the Ayurvedic treatment. These are some important studies I would like to quote, which are really nowadays are done by our scholars, younger scholars. So like Yavakshar is we use in benign prostate hypertrophy in the form of capsule. What it found that Yavakshar in BPH can prolong the surgical treatment. This is very important observation. In early stages, BPH can prevent the further progressive pathology of disease and gives symptomatic relief. So this study is important. Another study that is done on Veer Tarwadi Gand Kashai in case of Vata Stila. It depicts like at the end of the study, it is assumed that Veer Tarwadi Gand Kashai is quite effective. So these are our younger generation who studied on this. So we should always try to use such type of medicines also, which are been worked upon by our younger scholars. Again, correct Shigru, Punarnava, and is a combination which has been used along with Kanchnar and Chanpravati, shown good results. So this is also a plan of treatment we should try. Again, Devdarwadi Kashaya, the Spul Siddha Tel Uttar Basti in Mutraghat. This also, the subjective complaints were relieved highly significantly in the range of 67 to 93%. Residual urine volume was highly significantly reduced by 81%, whereas a statistically higher significant increase of 46% was recorded in the mean urine flow rates. So such type of studies are also done. Again, I would say that there are a lot of scope. This is, I think, this message I would want to, you can say, give to my end users or the person who are practicing in field. So these are the preparations which are available, readily available. Use them as per your the condition arises. So there, Mandvi, Uttar Basti, and Matra Basti in BPH. So this is also a good study. Again, Kanchnar Gugul and Balatil Matra Basti. This is also Kanchnar Gugul was used along with the Matra Basti of Balatil. So this has given a good result. Again, there are many studies like done on the Mustadi, Devdarwadi compound, Char and Uttar Basti management Mutraghat, many Kalpa Yogas, So there are a lot to, you can say, there are a lot of studies which are done, and really it is a matter of fact that we should focus on our own studies, which has been conducted by our own scholars. And if we will focus, we will find, you can say, solution of such type of problems. Coming to the conclusion, I would say that the dosh dhatu mal, and these are all, you can say, conditions. You can say, if you will find that among the trimal, major role is kled vahan. Kled vahan means how much, you can say, liquid content of our body is major disorder which comes to in such type of kled vahan due to obstruction. Ayurveda science describe detail about disease of urinary tract. Definitely, many diseases are described. Major area Mutra Apravrtij and Mutra Apravrtij Rogas. These are the conditions which are described. Ati Pravritti and Apravritti. Ati Pravritti, Prameha like yoga. Apravritti, Mutrakritsha, Ashmari and Mutraghayat disease. So, really wonderful description has been mentioned in our classics. The symptoms complex of both Mutrakritsha and Mutraghat be overlapping to each other, as also given. This example has also given by my earlier speaker. And the difference based on the intensity of vibandh or avrodh, obstruction, which is more pronounced, is mutraghat. Mutraghat is a condition where vibandh or avrodh is most prominent. So such type of condition may be kept under the mutraghat like condition. As per the etiopathogenesis of mutraghat is concerned, there is deranged function of apan vayu along with the vitiation of kapha and pitta produces am, which ultimately causes sroto avrodh. The vitiated dosh levels through sukshma nadis and finally lost to basti, whereupon further vitiation of apan. So such type of pathology we can understand or we can consider for this benign prostate hypertrophy, and we should focus on this management point based on these philosophy of our classical literature. With these words, I would like to thank you to the organizers for giving this opportunity to share my views with you all, and thank you all, everyone.
Very nice, very nice. Really, Ramakantji, excellent. You have communicated all the researches, moreover, on the prostate or Vatasthila or Mutraghat. Thank you. Thank you very much. Now, I would like to request Professor Dr. V.K. Agnihotri sir for his comments and open session.
Thank you. Thank you, Professor Pawan Sharma-ji. A lot of thanks to Professor Ramakant Yadav-ji. He very wisely and very concisely narrated whole of the scenario pertaining to prostate enlargement, and step by step he took all the details step by step, right from say of course he just tried to skip Nidan Paksh because it has already been projected by our earlier guest speakers, but still Samprati Garan was very good. DD is also given, and most of the things were projected completely based on the experiences. So it's itself a good thing that it amounts the trust and belief that what work you have done, especially when we talk about the say Kaya Chikitsa and Panchkarma, because there only we do some conservative treatment, or else if it is leads to grade 3, naturally as per Professor K.K. Sujoria's version, one has to refer Tattva Dhanvantri Arnam Adhikar Kriya Vidhau. Then Dhanvantri school will do the rest. I do remember the old one, way back in 1986 to 89, I think, Professor Sunil Joshi was doing some work over this prostate enlargement under Professor Elam Singh sir. And in Shushutwad itself, after a treatment with Varunadi Kashaya Basti, it was reported that the urine flow became such good that patient advised that he is not in any need of the Foley's. And in other words, it is said that the Foley's was out with that help. So how much it is Varnadikath is effective, so is the Ayurveda itself. So very, very good presentation, Dr. Ramakant Yadav. As usual, you are always having full hold over your subject and full concentration. And now, as per Professor Pawan Sharma's instructions, it is the time for group discussion, because as far as the male are concerned, it's a great problem with them, with their gender it is attached with, and of course above say 40 years of age at least in usual. So we have got a very good galaxy over today's webinar platform, and some persons are here to whom I could not take their version simply because of the lack of time, but it is 9:30. We have got almost 45 minutes to deal with and to receive all the persons great say experiences and somewhat suggestions and little bit treatment part. So we would like to start with first of all Professor Nishant Shukla is with us, and we have taken AYA, we have taken TVA College, we have taken little bit information from BHU. So now it automatically becomes a responsibility to take some information from Jamnagar also. So Professor Nishant Shukla is very much heartily invited over here. Sir, आइए, स्वागत है आपका. नमस्कार.
एक बात मैं
Thank
आपको
you very
कहूं.
much, sir.
हेलो,
नमस्कार सर.
जी सर नमस्कार. आपकी आवाज.
Am I audible?
Namaskar. Am I audible?
Yeah, good sound. Echoic sound is there.
Okay, fine. Actually थोड़ी जो है वो मेरी बैटरी लो है. Just a minute, मैं कनेक्ट कर लूं.
एक बात मैं कहूं आपसे.
Yes, sir. Am I audible now? Okay. Hello.
हाँ ठीक है डॉक्टर साहब, सुन रहा हूँ.
Okay, thank you very much, sir. Thank you very much, Sharma sir.
Professor Sajoria ji, आप कुछ कह रहे
हैं? A lot of time due to some technical glitches.
Sir, Dr. Shukla ji, एक मिनट. Sir, एक मिनट. Professor Sajoria is saying something before you.
Okay, sir.
Namaskar, sir.
After my work,
yeah,
I started first of all in India the role of this man Baron Kasaya Basti.
Right.
When I leave, Dr. क्या नाम इसका तो अपने वाइस चांसलर वहाँ के.
हाँ, सुनील जोशी.
उसके बाद पहले मेरे बाद में भारद्वाज जी ने स्टार्ट किया.
उन्होंने भी किया. यस,
नो डाउट. फिर भारद्वाज ने उसके बाद फिर इन्हें किया जोशी साहब ने.
भारद्वाज जी ने देशपांडे साहब का नाम किया था, इन्होंने प्रोफेसर लोकेश मान सिंह के नाम किया था.
No, first of all, I started work on this one under the guidance of this Pandey साहब, जब अपने यूरोफ्लोमेट नहीं था.
जी.
अलग पैरामीटर सुन के मैं that can't tell in details right now. So it is true when even if you are doing honestly, work honestly, जैसे कैसे books का नहीं, honestly आप करेंगे, even patients who were on Foley's catheter, beginning of the third grade prostate, they were removed and patient improved. This is I दस कर्म योगा शास्त्र ने करता. This is true fact है, तो इसलिए these things should be considered.
Sir, thank you so much for seconding and making a double sealed on the results of BHU, and we were just remembering it is 30 years back information, and since I was just going out and Sunil Joshi was joining and working, so it was reported. So this is really carrying on with the greatness of Varunadikath. So really, you just confirmed my information.
I was his examiner in BSU also. Thesis came to me. Just I am saying, जहाँ तक सवाल क्षार का है, तो क्षार कर्म का इतना रोल नहीं है। एक्चुअली अपान वायु विकृति से होता है। द रोल इज ओनली बस्ती थेरापी। उत्तर बस्ती का प्रॉब्लम क्या है? लॉट ऑफ कॉम्प्लिकेशन देयर। If aseptic conditions, then you can apply Uttarabasti very easily. There's no problem. Uttarabasti not only helping this prostate, they are good for the this one क्या बोलते हैं, atonic bladder also.
Yeah.
Yes, in they reduce fibroid also, and ladies also. So they have lot of. So that will take long time. Give the time psychology also. Thank you very much.
अब ये तो आपने थोड़ा सा उत्साहित कर दिया प्रोफेसर शुक्ला जी को। अब वो जामनगर का झंडा ऊंचा करेंगे। बीएचयू का झंडा तो दो तीन लोगों ने कर ही दिया।
जामनगर बनारस is a question of आदमी का personal experience.
We have to take other information also of the same importance. Yes sir.
बुक्स में बहुत कुछ लिखा, बुक्स में तो काफी प्रेफरेंस मिलेगी।
थैंक यू सर, थैंक यू सो मच। और सबसे बड़ी चीज है हमारे कुलवंत जी और सब लोग बीएचयू से ही तो जामनगर पहुंचे, कोई सी बात नहीं, सब अपने। अब प्रोफेसर शुक्ला जी जो है अब हमें और लाभान्वित रहेंगे। ये आइए, स्वागत है सर प्रोफेसर शुक्ला जी। जी सर।
Thank you very much, sir, for your kindness. आज के थियोरिटिकल पार्ट एब्सोल्युटली ये मूत्राघात का सभी जो है ये लिया सर ने, मैडम ने लिया और उस पक्ष को रखा, और ये प्रोस्टेट में काफी उपयोगी भी है। एक मैं अपना एक अनुभव शेयर करना चाहूंगा। एक मैं सेमिनार में गया था, दैट वाज ऑफ द कॉन्टेम्पररी मेडिसिन। ये यूरोलॉजिस्ट वहां पर जो है ये प्रेजेंट कर रहे थे। That was from Ambani's hospital, Dhirubhai Ambani Hospital, Mumbai. The surgeon, urologist from there. उन्होंने दो तीन पक्ष जो है वो इसके मैनेजमेंट में, प्रोस्टेटिक मैनेजमेंट, बीपीएच खास करके बीपीएच के मैनेजमेंट में उन्होंने रखे थे, और वहां पर उन्होंने साइज की जगह पर उसकी फिजियोलॉजी पर ज्यादा ध्यान देने की जरूरत कही थी। प्रोस्टेटिक एनलार्जमेंट और यूरिनरी रिटेंशन ये इम्पोर्टेंट है, और इन्फेक्शन को वो कंट्रोल करने की बात कर रहे थे। पर रिक्वायरमेंट फॉर दी सर्जिकल प्रोसीजर, उसके लिए उनका ओपिनियन था कि यूरिन फ्लो अगर मैनेज हो जाता है, then there is no need to go for these surgical procedures. तो ये उनका ओपिनियन था। और उस समय मुझे जो चरक में मूत्राघात और जो अस्टिला की बात और मूत्रक्षय की बात जो है ये प्रस्तुति में रखी गई, तो वो मुझे याद आया। और वहां पर फिजियोलॉजिकल करेक्शन, यूरिन फ्लो को किस प्रकार से मैनेज किया जाए, उस पर जो है ये फिजियोलॉजी किस प्रकार से करेक्ट की जाए, उस पर उन्होंने जो है वो ध्यान दिया था। और उस समय मुझे ये इनके रोल के बारे में ज्यादा जो है ये क्लियर हुआ था। प्रोस्टेटिक कैंसर में नो डाउट हमें जो है ये सर्जिकल प्रोसीजर्स पर ये हमें ये ध्यान देना ही पड़ेगा। और प्रोस्टेटिस जो होता है ये यूजुअली सर आपने हाईलाइट किया, ये डेफिनेटली एक बड़ा प्रॉब्लम है। और प्रोस्टेटिस यूजुअली 30s और 40s में ये इन्फ्लेमेटरी कंडीशन के रूप में ये मिलती है। तो वहां पर हमें कहीं ना कहीं मूत्रकृष्ण के हिसाब से चिकित्सा करनी पड़ती है, और उससे ये लाभ होता है। 2-3 योग उसमें जो चरक ने बताए वो मैंने यूज किए हैं। पहला शतावरी गोक्षुर सादे दुग्ध का है, उससे भी जो है वो हेमेचूरिया में इन्फेक्शन में
फ्लाइट केटी आसे गुधली आसे गुधली स्टाइल।
सर मैं कंटिन्यू और एम आई ऑडिबल? ओके सर। और दूसरा जो है वो यवक्षार और शर्करा का योग, ये पॉपुलर यहाँ पर है। तो ये इन्फेक्टिव पैथोलॉजी, अर्जेंसी डिस्यूरिया, बर्निंग मिक्चुरेशन, उसमें जो है ये काफी अच्छा जो है ये इसका रिजल्ट देखने को मिला है। जबकि अब लास्ट जो है ये प्रोस्टेटिक हाइपरप्लाजिया जो एज रिलेटेड होता है, उसमें मैं केवल एक ही चीज ऐड करूंगा। ये चरक ने 30वें अध्याय चिकित्सा स्थान में योनि व्यापक में ये बात रखी है, काठिन्याद ऊन भावाद्वा दोषोंतः कुपितो महान। तो ये काठिन्य और ऊन भाव के जो चेंजेस है ये एज रिलेटेड है, क्रॉनिक इन्फ्लेमेशन की वजह से है, पास्ट इन्फ्लेमेशन और इन्फेक्शंस की वजह से हैं। तो ये सारे फैक्टर्स ये या तो टिश्यूज में ये चेंज करते हैं और वो हाइपरट्रॉफी या हाइपरप्लाजिया या फिर एट्रोफी या एप्लाजिया में ये कन्वर्ट होते हैं। और उसमें कहीं ना कहीं जो है वो वायु का रोल जो है ये उपयोगी है। और मूत्राघात और मूत्रकृष्ट दोनों की चिकित्सा में और खास करके मूत्राघात की चिकित्सा में वायु का शमन जो है ये करने की आवश्यकता है। बस्ती वगैरह मैंने कभी किया नहीं है, इसलिए मैं उसके बारे में नहीं बोल पाऊंगा, पर शास्त्रीय रूप से तो जो है ये वायु की चिकित्सा के लिए उसका रोल है। स्ट्रिक्चर्स है वहां पर जो है वो एसेप्टिक मीन्स के साथ अगर हम उत्तर बस्ती करते हैं तो उसमें जो है ये मैंने खुद नहीं किया है, पर पंचकर्म के साथ जो करते हैं वहां पर उनमें रिजल्ट्स जो है वो देखे हैं। Thank you very much, sir, for giving me a chance to speak. Thank you very much, sir.
अग्निहोत्री सर अनम्यूट कर लीजिए, अनम्यूट कीजिए।
थैंक यू सो मच। मैंने आपके इस बात के लिए धन्यवाद कि आपने जो मैंने ग्रंथ की तरफ से जो चरक चिकित्सा स्थान अध्याय 3 के चैप्टर में चर्चा की, तो लिटरेरी सपोर्ट हमको मिलता ही है। बाद बाकी आपने जो यवक्षार और शर्करा का प्रयोग बताया, निश्चित रूप से मूत्र हैसियत से वो भी अच्छा काम करेंगे। बाकी बड़ा स्पष्टता के साथ आपने कहा कि पंचकर्म या वस्ती का हमारे पास अपना व्यक्तिगत अनुभव नहीं है, कोई बात नहीं। मैं प्रोफेसर विष्णु प्रसाद शर्मा जी का नमस्कार करता हूँ, अभिवादन इसलिए कर रहा हूँ कि आपसे भी आज मुझे अनुभव लेने हैं, लेकिन क्योंकि आप तो हैं ही साथ में हैं। अभी हम काफी दिनों से डॉक्टर सीपी शर्मा जी से हमारी ज्ञानवर्धन नहीं हुआ है, तो डॉक्टर सीपी शर्मा साहब आदरणीय जो हमारे एक्स डायरेक्टर रहे हैं और अच्छी पकड़ है उनकी चिकित्सा में और मरीजों पर, तो उनका स्वागत है। और उनके ज्ञान और उनके अनुभव से हम सब लोग लाभान्वित होना चाहेंगे। आदरणीय डॉक्टर सीपी शर्मा जी, आपका स्वागत है। ये नमस्कार
जी सर, प्रणाम सर।
प्रणाम। सर्वेभ्यो नमो नमः।
सर्वेभ्यो नमो नमः, सही को प्रणाम सर। आदरणीय अग्निहोत्री जी और पवन जी, साथ ही जो पूरी टीम है आपकी, शुक्ला साहब और आज के तीनों वक्ता, श्रद्धेय के सिजोरिया साहब, जो सिद्धांततः एक आयुर्वेद का भंडार है और जिसमें शल्य और शालाक्य के तो वो महारथी हैं, इसमें कोई दो राय नहीं। उन्हें कोई तैयारी की जरूरत नहीं है। वो कह रहे थे कि भाई मेरे को पवन जी ने बताया, वो तो बस उन्हें कोई इसकी जरूरत नहीं कि वो बहुत बड़ा, परंतु उनके जो ज्ञान का क्लिनिकल एप्लीकेशन सामने आया, क्लिनिकल व्यवहार जो उन्होंने कहाँ अपन कर सकते। साथ ही मैडम का अपना एक बहुत अच्छा प्रस्तुति रही। रमाकांत जी बेसिकली बहुत अच्छे, मैं तो कहूँगा आयुर्वेद के साइंटिस्ट, जो आज हमारी कंसेप्ट चल रहा है एविडेंस बेस्ड लाइन ऑफ ट्रीटमेंट हमारी चिकित्सा की रिसर्च के ऊपर, उसमें उन्होंने अपनी सिद्धांततः प्रस्तुति दी। इसके लिए वो तीनों वक्ता, परम श्रद्धेय सिजोरिया साहब को तो क्या कहूँगा, उनके तो चरणों में वंदन करूंगा और इन सबको हार्दिक साधुवाद और नमन। साथ ही अभी शुक्ला साहब का बिल्कुल स्पष्ट वक्ता शुक्ला साहब जो स्थिति है वो रखी। मैं भी बेसिकली फिजियोलॉजी का टीचर रहा, संहिता में मेरी पोस्टिंग रही और धुआंधार प्रैक्टिस करी, पहले एलोपैथी करी, फिर आयुर्वेद में आ गए, मास्टर बन गए आयुर्वेद के। तो जहां तक मेरा यहाँ अष्टीला के बारे में जो रहा, उसमें अष्टीला नाम से हमारे पास अष्टीला, प्रत्यष्टीला और बात अष्टीला, साथ ही मूत्र व संस्थान की जो भी वो है, मूत्राघात, मूत्रकट, ये सब है। तो मैंने जो अपनी प्रैक्टिस में अनुभव किया, उसमें जो मैं प्रैक्टिस में करता हूं कि उस संस्थान विशेष का रसायन जरूर मैं प्रयोग करता हूं। उन रसायनों में मैंने गोक्षुर और पुनर्नवा और शिलाजीत, इन 3 चीजों का विशेष परिणाम देखे हैं। हेलो हेलो
आपकी आवाज आ रही है आवाज,
जी,
आप
जी।
कंटिन्यू करिए।
तो वो मेरे को देखने को मिले, तो वहां पर एक हिंगवाद चूर्ण, योग रत्नाकर का योग है सर, हिंगवाद चूर्ण का मैंने प्रयोग किया, साथ ही अभयारिष्ट और बिडंगारिष्ट, गोक्षुरादि गुग्गुल, पुनर्नवादि गुग्गुल, ये सब चीजें। अब कांचनार भले ही बस्ती में भी वरुणादि कषाय के साथ में 10 मूल बस्ती प्लस, जैसा कि मैडम ने कहा था सर, वो बिल्कुल सही है, स्पष्ट है कि भक्वाशय गते बाते हितम स्नेह विरेचनम, तो स्थानीय स्नेहन और स्वेदन भी हमें पेशेंट को उपयोगी सिद्ध हो सकता है। स्थानीय अभ्यंग करके, और चाहे वो हमारा 10 मूल सिद्ध तैल हो या हमारा 10 मूल अश्वगंध और बात सिद्ध तेल हो, बला सिद्ध तेल हो, ये हमें अच्छे रिजल्ट देता है। अब आती है बात कि वहां के सिस्टम को, उस सिस्टम के जितने भी सेल्स हैं, उन सेल्स का हम जो एकल रसायनों को यदि अपन ध्यान दें, तो उसमें सबसे अच्छे रिजल्ट गोक्षुर हमें देता है। गोक्षुर बहु उपयोगी है। तो हम जो प्रयोग किए हमने अपने रोगियों में, उसमें वरुण, 10 मूल और बस पुनर्नवा और गोक्षुर करा। बाकी सभी वक्ताओं ने जो प्रस्तुति दी, उससे जो हमें ज्ञानार्जन हुआ, हम अपनी चिकित्सा को और चिकित्सा में अपना दक्षत्व सिद्ध करने का प्रयास करेंगे, क्योंकि आदत प्रैक्टिस की पड़ी हुई है, तो प्रैक्टिस तो छोड़ नहीं पाएंगे। इन्हीं शब्दों के साथ आज के सभी पूरी की पूरी टीम को बहुत ढेर सारी शुभकामनाएं, और जो अग्निहोत्री साहब आपने समय दिया, उसके लिए पवन जी और आपको पुनः प्रणाम करते हुए।
अरे सर, आपका प्लेटफॉर्म है, आपका समय है, आपके हमें आशीर्वचन मिल जाते हैं, हमारी वेबिनार धन्य हो जाती है। ये तो आप बड़प्पन है, आपने हमने समय दिया, हम तो आपको बुलाते रहते हैं। कई बार कनेक्टिविटी बीच में जो है बिलियन की भूमिका निभाने लगती है।
एक मैंने सर 10 मूल अरिष्ट और बिडंगारिष्ट का प्रयोग भी किया
जी।
10 मूल अरिष्ट और बिडंगारिष्ट का प्रयोग भी अच्छा देखने को मिला।
सर आपके बहुत धन्यवाद। और मैं चाहूंगा कि आज हमारे इस प्लेटफॉर्म जो नए लोग जुड़े हैं, मेरी अपील है उनसे, कृपा करके जो हमारे चैट बॉक्स में अपने डिटेल्स लिख देते हैं, स्पेशली फोन नंबर या ईमेल आईडी, तो बड़ी आसानी रहेगी हमको आगे उनको इनवाइट करने के लिए, उनको जोड़ने के लिए। और आज हम देख पा रहे हैं हमारे एक अभिन्न डिविजनल आयुर्वेदिक एंड यूनानी ऑफिसर शाहजहांपुर जुड़े हुए हैं। अब चूंकि बाई नेम नहीं जुड़े, लेकिन वो सुबह से शुरुआत से जुड़े हुए हैं। मैं उनका बहुत बहुत स्वागत करता हूं और चाहता हूं वो अपने
डॉक्टर राजीव होंगे।
डॉक्टर राजीव तो यहाँ हरिद्वार में है, डॉक्टर राजीव वर्मा नहीं।
राजीव कुमार, डॉक्टर राजीव कुमार।
राजीव कुमार, हाँ वही तो बार बार नाम दिमाग में आ रहा है। आपने अच्छा हेल्प कर दी हमारी। तो मैं चाहूँ डॉक्टर राजीव जी, आप मैं यदि आपको न पहचानूं तो कैसे काम चलेगा। मैंने 4 साल मेडिकल ऑफिसरी करी आपके डिवीजन में, धनौरा में, जरीनपुर में, तिलहर में, जलालाबाद में। तो आपका स्वागत है। आप बताइए कुछ आज के प्लेटफॉर्म में, आज के हमारे वेबिनार के सब्जेक्ट पर कुछ आपके अपने चिकित्सीय अनुभव हैं, तो आपका स्वागत है। और इस बीच हमें हमारे काम को आसान करने के लिए जिनके पास थोड़े थोड़े विचार हैं, थोड़ा सा हैंड रेज कर देंगे तो हम क्रम से उनको बुला भी लेंगे, समय की बचत होगी और हमें ज्यादा से ज्यादा लोगों का जो अनुभव है और उनका ज्ञान है वो हम लोगों को मिल सकेगा। डॉक्टर राजीव जी, आपका स्वागत है। आप जुड़ पा रहे हैं? हाँ, यस यस यस। आप अनम्यूट कर लीजिए। माइक तो अनम्यूट किया है इन्होंने, कनेक्टिविटी नहीं आ रही। हाँ डॉक्टर राजीव जी, आपका माइक तो अनम्यूट हो गया, लेकिन आवाज नहीं सुनाई पड़ रही है, आवाज नहीं आ रही है। हेलो डीओ साहब, शाहजहांपुर, उत्तर प्रदेश। नहीं आ रही आवाज। हाँ 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 हाँ, यस यस, नमस्कार नमस्कार, आ गए आ गए। आवाज नहीं आ रही है, एक बार वॉल्यूम कनेक्शन देखिए। आवाज नहीं आ रही। नहीं, आवाज नहीं आ रही है सर। डॉक्टर साहब थोड़ा अपना वॉल्यूम का थोड़ा चेक कर लीजिए, कनेक्शन कहीं गड़बड़ है।
ये ईयरफोन का माइक थोड़ा नजदीक कर लीजिए। ईयरफोन का माइक
जी आ गया, शुरुआत हुई। जी स्वागत है, स्वागत है।
हाँ, तो मेरी एक क्वेरी थी सर कि आज जो भी ये सेमिनार हुआ वो बहुत ही फ्रूटफुल रहा, लेकिन जो न्यूरोलॉजिकल यूरिन रिटेंशन हैं उनके बारे में कुछ जानना चाहता था। कुछ अगर बहुत
नहीं, बात तो आपने बहुत बढ़िया रखी। न्यूरोलॉजिकल भी होते हैं और कई बार साइकोलॉजिकल भी होते हैं और इमोशनल भी होते हैं। कहीं कोई सडन कोई अवसाद हो जाता है, डेथ हो जाती है, परिवार में कुछ होती है तो संकोच में जाना नहीं हो पाता, तो उस कंडीशन में भी बहुत बहुत घंटे कई बार फिर प्रेस किया जाता है कि उनको टीयरिंग हो जाए, उनको यूरिन पास हो जाए, उनको प्रमोट करते हैं। वो कॉन्सेप्ट बिल्कुल अलग हो जाएगा। मैं नहीं समझता उसमें कोई प्रोस्टेट के एनलार्जमेंट का कोई रोल बनता है, वो फिर न्यूरोलॉजिकल सेक्टर में चला जाएगा। फिर भी हमारे आज के
अपान वायु है सर, अपान वायु है हमारी
स्थानगत तो अपान वायु जी। फिर भी हमारे मनीषी कुछ इस पर कहेंगे तो आपके शंका का जरूर उत्तर मिलेगा। धन्यवाद आपका बहुत बहुत। हमने हमारे आपकी आवाज आ गई तो सबको सुनने को मिल गया। हम बुला लेंगे हम आखिर में। अभी जो हमारे आज के गेस्ट स्पीकर्स हैं उनके लिए हम फीडबैक लेंगे तो उसमें चर्चा आ जाएगी। इस बीच नव कुमार जी हजारिका जी असम से उन्होंने आने के लिए संकेत दिया है। हजारिका जी, आपका स्वागत है, आइए। नमस्कार जी। जी सर, अनम्यूट कर लीजिए। नव कुमार जी
हेलो
जी, हाँ आ गई आवाज, आ गई जी। स्वागत है।
नमस्कार सर, नमस्कार पवन शर्मा सर, देन स्पीकर्स। आज जो विषय रखा हुआ है बहुत बढ़िया विषय। ज्यादा जुड़ने का तो नहीं है, फिर भी हम प्रोस्टेट का केस देखता हो प्रैक्टिकल में, क्लिनिकल ट्रायल भी होते हैं। मेरा रिसर्च जैसा नहीं है, लेकिन 1-2 केस हमने ट्राई किया है, अभी भी ढेर सारा केस देखा है। तो इसमें जो मूत्रघात बोलते हैं ना, मूत्रघात और मूत्रकिस्स, इसमें हमारा जो पाषाण भेद बोल करके जो आते हैं ना, पाषाण भेद, तो हमारा यहाँ पे एक पाषाण भेद का भेद है। इसको दोपहर टेंगा भी बोलते हैं। दोपहर में दोपहर को ये अम्ल होते हैं और सुबह जब उठाते हैं बिफोर सनराइज, इसको क्षार्य होते हैं। तो ये दोपहर टेंगा इसीलिए बोलते हैं कि दिन में मतलब मिड डे में ये खट्टा होते हैं। इसका पत्ती उठा करके हमने सुबह जब बिफोर सनराइज हमने इसको दोनों तरफ खाते हैं। एक इसको थोड़ा पीस करके 15 ml along with वाटर खाने के लिए देते हैं। और ये इसका जो बाकी बचा हुआ जो सॉलिड पार्ट है इसको हमने पेस्ट बना करके बिलो अम्बिलिकल के साइड में हमने इसको लगा देते हैं। तब हमने देखा ढेर सारा पेशेंट को तुरंत यूरिनेशन आ जाता है, मोशन आ जाते हैं पेशाब के लिए, हमने ये देखा। दूसरा बात ये है, मेरा भी एक क्वेरी है इसमें। क्वेरी मतलब ओपिनियन है, क्या हमारा जो आयुर्वेदिक बस्ती कर्म या मेडिसिन, ऑरल मेडिसिन, इससे हमारा जो प्रोस्टेट एनलार्ज का जो केस होते हैं, जैसे बिनाइन बोल करके, बिनाइन प्रोस्टेट बीईपी, उसमें क्या परमानेंट सॉल्यूशन होते हैं क्या? हमने तो ढेर सारा केस देखा जिसमें हमने 3 महीने, 1 साल, 1.5 साल हमने दवा दे करके देखा, बस्ती तो नहीं किया। लेकिन इसमें हमने देखा बाद में ये ऑपरेशन करती है, जैसे ट्रांस यूरेथ्रल रिसेक्शन टी करके करते हैं।
आपने सही अपनी शंका उठाई है। एक तो आपने अपने क्षेत्र में पाई जाने वाली जो पाषाण भेद से, और दूसरी वो पत्ती आपने सुबह सूर्योदय से पहले चबाने की बात कही, वासक तो ठीक है। आपने हमारे प्रथम और द्वितीय वक्ताओं को ध्यान से सुना था, तो
ये मेरा जी सर, यही मेरा बोलने का है।
मैडम ने भी और हमारे प्रोफेसर यादव जी ने भी, बल्कि सूर्या साहब ने पहले ही कहा था कि हमें स्टेज के ग्रेड के हिसाब से 1-2 के हिसाब से ही ये रखना है। और अगर 3rd ग्रेड में चला जाता है तो हम प्रत्याख्य कह के इधर कच्चे साथ की स्थिति रहती है। तो हर किसी केस में, या स्पेशली बीपीएच के माने एक्स्ट्राऑर्डिनरी इलाजमेंट के मामले, जो कि रिटेंशन रिपीटेडली हो रही है और स्ट्रिक्चर हो गया है, उस केस में सर्जरी तो रिकमेंडेड है ही है। पूरा डिटेल से बताया था इन लोगों ने। ऐसा नहीं केवल हम पेशेंट को डिले करते रहे और बाद में उतना ज्यादा एडिशन बच जाए कि रेक्टम तक इन्वॉल्व हो जाता है, बहुत टफ टाइम आ जाता है। तो सर्जरी भी अगर है तो सर्जरी का भी सिलेक्शन टाइमली हो जाना चाहिए। जो इलेक्टिव सर्जरी इसको बोलते हैं, एज पर द क्लिनिकल मैनिफेस्टेशंस, वो होता है। आपका बहुत बहुत धन्यवाद आपके इनपुट्स के लिए और आपकी क्वेरी के लिए। हम आपको हम और इंफॉर्मेशन दिलवाएंगे अपने गेस्ट स्पीकर से। साथ साथ अभी हम एक राउंड ले लेते हैं। तो डॉक्टर आशीष कुमार मिश्रा जी हमारे जुड़े हुए हैं, लगभग रोज ही जुड़ते हैं, उनके विचार नहीं ले पाते समय के अभाव में। आज हमारे पास कुछ समय है। डॉक्टर आशीष कुमार मिश्रा जी, आप ऑन कर लीजिए, अपना अनम्यूट कर लीजिए माइक को, और आज के वेबिनार के टॉपिक पर आप अपने कुछ विचार, कुछ अनुभव रखना चाहेंगे तो स्वागत है उसका। नमस्कार जी।
नमस्कार अक्सर, नमस्कार। बस अक्सर मैं तो चूंकि प्रैक्टिशनर हूँ और लगातार प्रैक्टिस कर रहा हूँ, तो बहुत सिंपल मेडिसिन से मैं लगातार इसका इस्तेमाल करता रहा हूँ, इसमें प्रयोग करता रहा हूँ। और मेरा तो जो बहुत कॉमन मेडिसिन थी, जिसमें गौक्षुरादि गुगुल, काचनार गुगुल, वर्णादि क्वाथ, इन्हीं को लेकर के ही मैं मीन चलता रहा। लेकिन हाँ, आज के वेबिनार के बाद में मैंने भी काफी कुछ ज्ञान प्राप्त किया है और मैं भी आगे कोशिश करूंगा निश्चित रूप से। और बहुत अच्छा लगा, वक्ताओं ने बहुत ही अच्छा जो है आपके एक रास्ता दिया है।
रोगी में रोग की अवस्था को देखते हुए आप प्रैक्टिस कंटिन्यू करेंगे, और जहां देखते हैं कि अभी वो कंजर्वेटिव ट्रीटमेंट में नहीं नियंत्रण आने वाला है और उसकी सर्जरी अब हो गई है, तो प्रत्याख्य कह के उनको आप संदर्भित करने का भी रखेंगे, तो हमारी मानवता के प्रति सही सेवा होगी और अपना आयुर्वेद भी उतना ही यशस्वी बना रहेगा। बहुत बहुत धन्यवाद आपका, बहुत धन्यवाद आपका जुड़ने के लिए। और डॉक्टर लीना जी कुछ कहना चाहेंगी? आज डॉक्टर लीना करेकर जी काफी टाइम से उनसे भी विचार नहीं मिले, हालांकि ये मेल्स की प्रॉब्लम है, बट ये उनके अनुभव हो। और डॉक्टर नीलाक्षी देव चौधरी जी भी जुड़ी हुई हैं आज, और हमारे पास 5-5 मिनट में हम सबका एक जो अभी नहीं आज अपने विचार दिए हैं, उनका स्वागत करते हैं। और उसके साथ साथ हमारे प्रोफेसर विष्णु प्रसाद जी का तो रिजर्व में रखे ही हुए हैं। मेरा मन है कि चूंकि हमारे गेस्ट स्पीकर सभी जुड़े हुए हैं, तो सिजोरिया जी तो अपना एक स्टेटमेंट हमारे उस BHU वाले के फेवर में दिया ही था। मैं एक बार पुनः डॉक्टर रमाकांत जी को बुलाना चाहूंगा कि वो अभी तक जो चर्चा हुई और जो हमारे श्रोताओं की तरफ से कुछ क्वेरीज आई हैं, तो उसमें कुछ अपना और थोड़ा सा और सिंप्लीफाई उनका समाधान देते हैं। तो जो प्रैक्टिशनर्स हैं, जो सिंपल माने फिजिशियंस हैं, तो वो किस स्टेज पर केसेस को सर्जरी के लिए रेफर करें, रिकमेंड करें, ये थोड़ा उनको इसका एक डिमार्केटिंग लाइन जो है वो थोड़ा बताइएगा तो जी अच्छा रहेगा। नमस्कार
जी सर। बहुत सर थैंक यू सर इनवाइट करने के लिए। मुख्य रूप से जो है सर, जहाँ तक ये शास्त्र में तो बहुत सी चीजें वर्णित हैं, लेकिन जब आप पेशेंट सर हम लोगों के पास आते हैं तो उनका जो प्रेजेंटेशन है वो बिल्कुल एक कई बार अलग तरीके से भी दिखता है। कई बार जब आप बैठे होते हैं तो ये जो औषधियाँ जो है बहुत सी शास्त्र में लिखी हुई हैं वो उपलब्ध नहीं होती हैं, पास जो उपलब्ध होता है उससे आपको काम चलाना होता है। तो ऐसे में जो है आपके पास जैसे कोई प्राइवेट प्रैक्टिशनर है, अभी हमारे पहले सर कह रहे थे कि प्रैक्टिशनर है, लेकिन प्रैक्टिस में भी आप जो है कुछ लिमिटेड मेडिसिन ही अपने पास रख पाएंगे, कोई बहुत वैरायटी आप नहीं रख पाएंगे। तो उसमें हम लोगों के, जैसे मैंने एक रेफरेंस दिया था ना कि जो अपने पेटेंट कुछ योग हैं उनके पर भी बहुत सीरियसली सोचना चाहिए और बहुत अच्छी प्रिपरेशन है उनकी। तो मुख्य जो सिद्धांत है सर, जो उसको फॉलो करना चाहिए, जैसे कि एक वायु का अनुलोमन, अगर एक सिंपल सिद्धांत है, मैं कई बार कहता हूँ कि आयुर्वेद को कॉम्प्लिकेट ना करके जो बहुत सिंपल स्ट्रेट लाइन चीजें हैं, सिंपल सिद्धांत हैं, उनको फॉलो करके रखें। जैसे एक उसी में से एक सिद्धांत है वात का अनुलोमन करना। तो वात का अनुलोमन कर देने से ही जो है बहुत सा जो है आपकी समस्या सॉल्व हो जाती है। जैसे मान लीजिए कोष्ठ, जैसे कोष्ठ है, कोष्ठ शुद्धि करा दीजिए आप। प्रोस्टेट के पेशेंट जो आते हैं, हम लोग जो फॉलो कर रहे हैं सर, जो अभी प्रैक्टिस में फॉलो कर रहे हैं कि नित्य विरेचन एक सिंपल सी क्रिया है। कुछ भी जो है आपके पास एरंड भ्रष्ट हरित की होगी, आपके पास गोमूत्र हरित की होगी, आपके पास कुछ नहीं है तो पंचसकार होगा, स्वादिष्ट विरेचन होगा, कुछ तो होगा आपके पास। वो आप कोई भी एक दे करके आप उसको कोष्ठ शोधन डेली बेसिस पे कुछ कराते रहें, जिससे उसकी जो इंटेस्टाइन की जो आप कह सकते हैं कि जो वायु का दबाव है या प्रेशर है जो है वो चीज़ें नहीं होने पाए। तो एक तो बड़ा आपको जो है कॉन्स्टिपेशन रिलीव करते ही बहुत सारा रिस्पॉन्स मिलता है। दूसरा जो एक प्रिवेंशन वाला पार्ट है, हम लोग उसको कई बार बोलते हैं कि ये जो आप पानी की मात्रा और जो है टाइम से यूरिन आउटपुट, ये बहुत इंपॉर्टेंट है कि आप कितना पानी पिए और अपने आप का वेग रोके नहीं। दूसरे सर एक बहुत इंपॉर्टेंट फैक्टर है सर जो प्रैक्टिकली देखने में आता है कि अगर कोई व्यक्ति जो है अगर सेक्सुअली एक्टिव है तो उसको जो है वो कंटिन्यू करना चाहिए, प्रमोट करना चाहिए, सो दैट कि वो जो प्रोस्टेट की स्क्वीजिंग होती है वो होती रहती है, और ये जो डिट्रोसर मसल के रिस्पॉन्स और ये सब हैं, ये डेफिनेटली जो है रिस्पॉन्स अच्छा मिलता है और मसल्स की टोन अच्छी रहती। तो एक ये जो है इसको भी प्रमोट करते रहना चाहिए अगर कोई व्यक्ति मतलब एक्टिव है तो। अदरवाइज जो है बाकी आपके पास मेडिसिन बहुत है, अभी प्रैक्टिशनर सभी लोग हैं, वरुण है आपके पास।
डॉक्टर यादव जी एक चीज के साथ में और अगर जोड़ लेते हैं कि ये प्रमोशन अगर रेगुलर बेसिस पर मेंटेन रहे, मैं समझता हूँ ये प्रमेय के मामले में भी और अधिक सपोर्टिव हो जाएगा, क्योंकि कहते हैं ना प्रमेय वाले लोगों के लिए ये लेथार्जिकनेस आ जाती है, उससे अवॉइड करते हैं, तो दैट विल इटसेल्फ इज एनकरेजिंग।
वो भी एक अच्छा हो सकता है उपाय। और बाकी सर जो मेडिसिन हैं सर, मेडिसिन अपने पास जो हैं बहुत, जैसे मान ली गोक्षुर की प्रिपरेशन हैं वो आप यूज कर सकते हैं। इसी तरह से जो है सर शिग्रू की प्रिपरेशन हैं वो आप यूज कर सकते हैं अच्छे से। और वरुण है, जितने भी जो है अश्मरी भेदन वाला जो गण है, मूत्र विरेचनी है, मूत्र विरजनी है, ये जो तमाम हम लोगों के पास एक विकल्प मौजूद है। जैसे अश्मरी भेदन वाला है, अच्छा ये होगा पाषाण भेद होगा, है ना, कुल्थी होगी, और वरुण होगा, शिग्रू है ना, गोरक्ष गांजा है, गोखरू है, बहुत से मतलब उपयोग हैं जिसको आप उसको कंबाइन करके कर सकते हैं। सबसे बड़ा सर जो है सिंपल है, श्वेत परपटी, उसको कई बार हम लोग वो करते हैं। लेकिन अगर आप श्वेत प्रपटी को वरुण के क्वाथ में मिक्स करके आप दीजिए तो एक क्षार प्रभाव के कारण वो सर थोड़ा सा लेखन का भी कहता है और वो मूत्र की प्रवृत्ति को भी ठीक करता है। तो ये चीजें अनुभूत हैं सर, ये जो हम लोग कॉमनली प्रैक्टिस में यूज कर रहे हैं। और कई बार डेफिनेटली सर, जैसे सिजोरिया सर ने कहा कि अगर वो ग्रेड 3 एंड अबव जा रहा है तो डेफिनेटली अब चूंकि रिट्रोग्रेड प्रेशर रहेगा तो जो है वो किडनी तक पायलोनेफ्राइटिस वगैरह होने की पॉसिबिलिटी रहती है। तो उस चीज़ को अवॉइड करने के लिए सर्जरी के लिए जाना ही चाहिए। लेकिन उससे पहले जब तक अगर आप इनिशियली प्रिवेंशन पे आ जाएंगे तो ये सर्जरी है हमारी समझ से लंबे समय तक अवॉइड हो सकती है वैसे। क्योंकि कई बार ये देखने में आता है, अब तो नहीं, पहले जो ऑपरेशन होते थे अब तो TURP जो हो रहे हैं ऑलमोस्ट वो ब्लड लॉस वगैरह काफ़ी कम हो गया है उसमें। अदरवाइज जो पहले अर्लियर जो पुराने समय में ऑपरेशन होते थे तो उसमें ब्लड लॉस बहुत होता था, तो कई बार वो सक्सेसफुल नहीं होते थे। बट आजकल जो टेक्निक्स आ गई हैं थोड़ी सी नई, तो उनमें जो है ब्लड लॉस भी कम हुआ है और वो सस्टेन करती हैं चीज़ें। तो उससे भी घबराने की जरूरत नहीं है। अगर किसी को मान लिए एज परमिट करती है तो वो भी उसके लिए भी जाना चाहिए, लेकिन उससे पहले एक बार कोशिश करें। और हम लोगों के पास सर रेफर होके पेशेंट्स आ रहे हैं, आपको ताजुब होगा कि हम लोगों की ओपीडी में रेफर होके पेशेंट्स आ रहे हैं। और इसी चीज़ से सर मोटिवेट होके हम लोगों ने एक यहाँ अभी अपने इंस्टीट्यूट में, ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा में एक नेफ्रोलॉजी यूनिट करके खोली है, आयुर्वेदा नेफ्रोलॉजी यूनिट।
ये रेफर मींस मॉडर्न साइड से रेफर होके आ रहे हैं।
जी सर, जी सर।
यही
वो
यही
लोग
यही कहना चाहता
हाँ
आप खुल के कहिए ना, यही तो मुझे यही आइडिया हुआ। केवल मतलब सर्जन से पहले कि एक बार पहले कंजर्वेटिव करा लो फिर देखते हैं, मॉडर्न साइड से आ रहे हैं। वेरी गुड, वेरी गुड। एक पॉइंट आपने और बड़ा अच्छा रखा, श्वेत प्रॉपर्टी हम लोग भी देते करते हैं। आपने जब श्वेत प्रॉपर्टी को रोनादी क्वाथ में डाल के दिया, उससे एक और सेफ एक्सरसाइज हो जाएगी कि जो कई बार ओरल कॉन्ट्राइशन हो जाता है उसमें इतना तीखा डालता हूँ पानी में, आधा कप पानी में घोलवा के देते हैं, नहीं तो कई बार पेशेंट आते हैं कि खाते के साथ देखो चले हो गया, तो वो भी सेफ हो जाएगा,
सेफ हो जाता है सर। इसीलिए सर वो
बहुत से पॉइंट है। और वैसे भी वरुण अपना काम करेगा ही, इसके साथ देता और बहुत ही अच्छा सजेशन, गुड, ये प्रैक्टिकली अच्छा काम करेगा। आपको बहुत बहुत धन्यवाद। आपको तो जब भी सुनते हो तो लगता है कुछ नई चीज मिलेगी। आपका बहुत बहुत धन्यवाद, आप जुड़े रहिए। आपने कहा भी हम जुड़ेंगे। मेरे साथ में प्रोफेसर निशांत शुक्ला जी ने कुछ और एड ऑन करना चाहेंगे, क्योंकि चर्चाएं काफी हो गई हैं, और उनको लेके और उसके बाद फिर हम आशीर्वचन के लिए प्रोफेसर विष्णु प्रसाद शर्मा जी के पास जाएंगे, जिससे कि आज की पूरी कार्रवाई का एक अच्छा सा समापन, एक अमलगमेशन अच्छा सा बन जाए। तो डॉक्टर निशांत शुक्ला जी, आप कुछ
सॉरी सर, मैंने जो बाकी लोग हैं उनका मैं थोड़ा जो है वो समय खा रहा हूँ, पर अभी जो डिस्ट्रिक्ट आयुर्वेद और यूनानी ऑफिसर ने जो बात रखी, मैं उनका नाम भूल गया हूँ, सॉरी फॉर दैट वन। तो उनकी जो बात है वो
डॉक्टर अजीत कुमार जी,
हाँ, यस सर, थैंक यू वेरी मच। तो उन्होंने जो बात रखी, यूरिनरी इनकॉन्टिनेंस एक एज रिलेटेड एक स्फिंक्टर लॉस ऑफ स्फिंक्टर कंट्रोल, न्यूरोजेनिक ब्लैडर, ये एक काफी इम्पोर्टेंट समस्या है। लेडीज में ये कफिंग के कारण बिक्चुरेशन ये हो जाता है, यूरिन पास हो जाता है, ये भी एक ये प्रोस्टेट की तरह ही एक इम्पोर्टेंट समस्या है। और ये कहीं ना कहीं ये मूत्राघात में ही इसका कंप्लीटली डिस्क्रिप्शन जो है ये नहीं मिलता है। प्रैक्टिकली तो हम उसको जो है वो विषतेंदुक या फिर अग्निटुंडी या फिर ऐसे मेडिसिन दे करके, कोकिलाक्ष दे करके उसको हम मैनेज करते हैं। पर सर ये भी एक इम्पोर्टेंट टॉपिक है दैट इज टू बी कंसिडर्ड फॉर डिटेल्ड डिस्कशन इन दिस फोरम।
सर ठीक सर, थैंक यू सो मच। और निश्चित रूप से ये तो मानना ही पड़ेगा, इसमें भी अपान वायु का बीमारी होने के कारण ही ऐसा हो रहा है। उसका जो अपान वायु का अगर हम अनुलोमन होता रहेगा, उसके लिए सिंपल हिंगबस्टक चूर्ण ही रेगुलर चलता है तो अजीर्ण भी दूर करेगा, अपान का वातानुलोमन भी करेगा, और साथ साथ दीपन पाचन के काम करेगा, भूख लगाएगा, पेट भी साफ रखेगा। इन्होंने कहा ना कि हिंगू हो या कुछ ऐसी चीज हो, तो मैं तो इस बात के लिए बड़ा फैन हूँ। ये हिंगबस्टक हमारा दूध पापेश्वर का हमेशा इसलिए साथ रहता है कि प्रोस्टेट से लेके हर चीज पे ये बहुत जबरदस्त काम करता है। ठीक है, थैंक यू सो मच सर, आपने जो न्यूरोलॉजिकल ब्लडर वाली बात पकड़ी, अच्छा किया, धन्यवाद आपका। तो मैं समझता हूँ जितने भी लोग हमारे मनीषी लोग आज प्लेटफॉर्म से जुड़े हुए हैं, सबके बहुत ही गहन विचार आ गए, और गेस्ट स्पीकर की तरफ से डॉक्टर निशान जी, डॉक्टर रमाकांत यादव जी के विचार आ गए हैं। अब हम प्रोफेसर विष्णु प्रसाद शर्मा जी से ये एक आग्रह करेंगे कि वो अपने इतने लंबे चिकित्सीय जीवन में और आसाम में, हमारे आसाम स्टेट में आने वाले पेशेंट्स और उन पर आपके अनुभव आज के इस सॉरी प्रोस्टेट के लिए क्या रहे, उसको उपलब्ध करा के हम लोगों को लाभान्वित कराइए। आपका बहुत बहुत स्वागत है। नमस्कार जी।
नमस्कार बेटा जी, धन्यवाद। तो प्रोस्टेट एनलार्जमेंट ये तो बिग प्रॉब्लम है, लेकिन पीपल आजकल आयुर्वेद मेडिसिन चाहते हैं, और कोई लोग का तो ऑपरेशन करने में भी दिक्कत होते हैं, तो उसमें भी वो लोग कैसे विदाउट ऑपरेशन आयुर्वेदिक दवाई खा सकेंगे या हम लोग प्रिस्क्राइब कर सकते हो। No doubt, we have a very good medicine. Normally in my practice, first of all, I offer my sincere thanks to Dr. K.K. Caesaria for excellent presentation on Nidan Samprapti और मेडिसिन के बारे में अच्छा तरफ से क्या सुरक्षित पर क्या क्या मेंशन है उसका एक्सपीरियंस भी बोले हैं। सो धन्यवाद ज्ञापन करते हूँ। और डॉक्टर प्रियदर्शनी भी ऑपरेशन भी करते हैं, ड्रग्स भी यूज करते हैं, मैडम को भी धन्यवाद ज्ञापन करते हूँ। और डॉक्टर रमाकांत यादव जी तो हमारे तरफ से धन्यवाद ज्ञापन करते हूँ। वो रिसर्च क्या क्या किए है वो भी प्रेजेंट किए हैं, और which medicine is useful, nicely described, which body is effective, nicely described. So now I want to speak regarding my experience, what type of medicine we use. We use patent medicine, जो एलार्सिन का है, बोंगसिल और फोर्टिस, लेकिन ऐसा बात नहीं, पेशेंट हैज टू टेक लॉन्ग टर्म। इससे तो हम लोग प्रिवेंट करा सकते हैं। सेकेंड ग्रेड हो गया, थर्ड ग्रेड हो गया, रिड्यूस हो जाते हैं, फ्लो भी ठीक तरह से होते हैं। साथ फॉर इफ एनी यूरिनरी ट्रैक इन्फेक्शन है तो हम बृहद पुण्य चंद्र रस कुछ दिन यूज करते हो, बृहद पुण्य चंद्र रस गोल। और नहीं तो आजकल एल्केम का एक हर्ब्स आए है प्रोस्टाक्विल करके, कॉस्टली है। फ्यू डेज हम लोग एक एक करके 2 बार देते हो, उसके बाद एक कैप्सूल लगातार लेते रहिए। इन सम केसेस वी यूज अलोंग विथ यस बंसिल फोर्टिस देते हो, साथ फॉर पुनः नवादी गुगुल, उससे भी हम लोग अच्छा रिजल्ट आते हैं। सो वही है। एंड बाकी तो पेशेंट का कंडीशन का ऊपर क्या क्या होते हैं, लेकिन हमारा एक्सपीरियंस यही है, ये दवाई सिंपल है, कारण ज्यादा दवाई देने से भी पेशेंट लोग प्रिफर नहीं करते। टेबलेट फॉर्म है, कैप्सूल फॉर्म है, इजी टू कंज्यूम, और उससे बस हमारा पास तो बहुत केस है, जैसे डॉक्टर साहब ने बताया, मेडिकल कॉलेज से भी हम लोग का पास आते हैं, शर्मा साहब के पास जाइए, कुछ आपको हेल्प करेगा। लेकिन हम लोग देख करके देखे हो, अच्छा रिजल्ट तो हुए है, अच्छा रिजल्ट हुए है। सो थैंक यू वीके अग्नेत्री to giving me some.
Thank you for your so many inputs and especially your personal experiences. And it's a pleasure that Ayurvedic medicines are still working in such a way that the modern medicine for persons from hospitals, they are referring to you. It's wonderful. Almost I have completed my work, but I am seeing that in list, Madam Gunratne ji is still with us, though she was probably due to leave at about 9 p.m. of Indian time. So if she is there and she is interested to say something add on as a guest speaker, to just make some feedback, I would very humbly like to invite her. Madam, if you are here, you can bless with some of your words. Madam KCP Gurunatne ji.
Thank you, sir.
Thank you. Thank you.
Actually, yes, actually the problem is we had power cuts because of that. That's why I told, but the power came by 9 o'clock. So I continuously with you all, sir. So actually I also practicing and I also learning lot of these things with you all, with this all your platform. Actually, I must thank for you because you have given us such a
we can understand your problem. Yeah.
Yes, sir.
Ma'am, thank you so much,
So
and please continue to join. Today we heard from you after a long gap, say 1.5 months or so. Probably in New Year we are hearing you for the first time in
yes, sir.
2023.
Actually, normally, sir, I am joining with the surgical topics. Last month, I think you have not given that much surgical topics, so that's why I couldn't join with you also.
Okay. But you are most welcome if you are interested to join our music topic, our this Kavi Sammelan, anything. We have celebrated, and we might be celebrating our Shivratri also. We are celebrating Pongal, Makar Sankranti, Loli. So your presence in a form of our one of the component is equally important, irrespective of the subject and pertaining to Ayurveda. But still, we are so kind of you. Thank you so much, madam. Thank you.
Madam
Thank you, sir. Thank you.
Madam Priyadarshini,
Yes.
I want your email and phone number. Can I get? I'll be happy.
Yes, sir. Sure, sir.
Please put in the chat. Please put in the chat box so that we all will be benefited.
Yes, sir.
With all your
any Ayurvedic courses are there at your Sri Lanka?
Yes, sir. Some are conducting some courses, sir. Yes.
Some courses.
So we have number. Yes, sir.
Then please give in chat box your email and phone number. Then I can contact you or I can talk with you.
Yes, sir. I already sent, sir.
Already sent. Okay, madam. Thank you very much.
So much. So,
thank you.
with all your great kindness, especially by our guest speakers of today's seminar became very vital and very informative. I extend great thanks to all our guest speakers, and really they enlightened us, and it became a record in our webinar. One can visit anytime, whenever leisure time they are having. And by extending our heartfelt thanks and greetings to all of them, our guest speakers, and also those who participated right from CP Sharma sir, Professor Nishant Shukla sir, everybody, we are feeling indebted with all these great contributions. Of course, Hajarika ji also, and I am not in position to leave any person's name otherwise. So Dr. Dio Saab, Hamare Rajiv ji, everybody is really good, and now I will just with all these comments, I would like to refer back to Professor Pawan Sharma ji, so that he will make a formal conclusion of today's webinar. Thank you so much. Namaskar.
Thank you, sir.
पवन जी,
थैंक यू वेरी मच सर, थैंक यू वेरी
पवन जी, एक रिक्वेस्ट है आपसे
जी।
जब भी अपना वेबिनार समाप्त हो तो अपन शांति मंत्र जरूर बोले।
5 रह जाते हैं, कभी कोई 5, 4, 6 रह जाते हैं।
अरे एक तो रहेगा
नहीं, 11:15 बजे लगते हैं।
अपन 3 तो रहेंगे ना सर?
ठीक है, ठीक, आपका सजेशन वाइटल है, लेकिन हम लोग हमेशा शांत हैं। हम लोग विश्व शांति पर विश्वास करते हैं। हृदय में, मन में शांति होनी चाहिए। अब भूख लगी हो, निकलना हो तो कहाँ आप शांति करेंगे? टाइम ज्यादा हो जाता है अक्सर, 11:15। चलिए, आपका सजेशन है, आप कर दीजिए शांति पाठ। आज तो समय है जी। प्रोफेसर पवन शर्मा जी शायद मूवमेंट में है, शायद भी। सर करिए। यस सर, आप म्यूट है सर। पवन जी, आपका माइक म्यूट हो गया। आप डॉक्टर सीपी शर्मा साहब, आप कर लीजिए, सूक्ष्म वाला कर लीजिए जब तक।
ओम पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ओम शांति शांति शांति।
ठीक है सर।
हम लोगों की तरफ से आप सबको बहुत बहुत शुभरात्रि, सबका आभार, नमस्कार।
Thank you.